years of president of the Academy of FABM now, which is
three knowledge from you. We have good nutrition.
Yes.
We have good breastfeeding.
When they are struggling, you are doing great.
Okay.
Doing the best you can. And to this point,
Yes.
you can congratulate yourself.
Yes.
Well, perhaps it even started in Indonesia. I have studied at the University of Amsterdam, Free University,
It's really nice of you.
and I had a professor there.
Okay.
And I wanted to write. I didn't have children myself, but I had to write something about the influence of the maternal nutrition, of the quantity and quality of breastfeeding. And I asked a professor, Professor Guus de Jonge, and he said, well, he was such a nice man. And he said, well, Elien, I will take you. And he brought me in breastfeeding medicine, and he learned about the importance of breastfeeding because he was stationed as a Dutch physician on one of the Indonesian
I see.
islands, and there recognized the importance of breastfeeding, and he brought this conviction to the Netherlands again, where there was a lot of formula, and he was the first on that level as a professor, head of the University Department of Pediatrics. And he started doing breastfeeding medicine in the Netherlands in the 1980s. And I started in 1982, I think.
82?
Yes.
Wow.
Yes.
It's a very long journey.
So it's a very long journey, and from there I really learned a lot, and I was a member from the beginning of the Academy of Breastfeeding Medicine. I've been on the board in several positions, and I have been 2 years of president of the Academy of FABM now, which is the big international physician organization of about breastfeeding. And so the academy has become my professional home. So where I can exchange with colleagues, especially that's why I'm here too, with colleagues from around the world, and to look how we can serve mothers, babies, and families the best we can.
Okay, I think it's very. You have a good heart. If I learned from your share just now, you have a very good heart, because you say you didn't have children, but you dedicate yourself to breastfeeding.
Yes. Now I have children, I have to say, but although one of our founding members, Miriam Lebok, she was one of the most inspirational women in breastfeeding medicine I ever met, and she never had children.
Really?
No.
Okay, it's very. You have a good heart, because I also feel myself. When we have children, we can give our love to our child. But how if you didn't have children? How you practice the breastfeeding? But if you can, I mean, like you dedicate yourself. I think you have very loyal to breastfeeding.
Yes.
I think you have a good heart, because
Thank
it's very difficult if we never learn.
Yes. Yes. Yes.
But if the Maria the Bull, it's very good heart.
Yes, yes, I can complete. She unfortunately died very early, but she was my great inspiration. And what I think what I really feel about breastfeeding from the beginning, it's first about the nutrition. It's about the prevention. When you look the Lancet series already in 2003 or 4 said breastfeeding is one of the primary ways of preventing disease.
Yes.
With mothers, when you look at breast cancer, at heart disease, at ovarian cancer and some other stuff, diabetes. Secondly, of course, we always think of the children. There is a lot of prevention going on there, and we even learn more about this through these microbiome and epigenetic stuff, that it far more influences us when we ever could imagine when we are breastfed.
Yes.
And the society.
It's very nice of you. And then I learned three things, three knowledge from you. It's the first thing from breastfeeding is nutrition.
Yeah.
Yeah, I think that's true. Because if we have good nutrition,
Yes.
we have good breastfeeding.
Yes, exactly.
Okay.
Maybe second question.
Okay. Next question. In your opinion, what is the key to successful exclusive breastfeeding? In your opinion,
What is the key?
I think a good environment,
Good environment.
a supportive environment. Because we, in the past, and I have to say, I have learned a lot myself about that. We thought, well, when the mother is giving all her best, she will do it.
Yes.
But that's not only, it's one element.
Okay, one element.
It's also, does the mother get the right support from her surrounding, the environment? Is there from the family, but also from physicians, from nurses, from midwives? Do they give the correct answers when she has problems with breastfeeding? Does she have support when she's ill? Is she getting bombarded with commercials about bottles or complementary feeding, or is she not? Is she protected by that?
Yeah.
You know, because I don't know how it is in Indonesia, but in the Netherlands or Germany, the countries I know best, there's a lot of advertising and pressure, even by pediatricians,
Really?
to start complementary feeding on 4 months. And so when you as a mother hear from your pediatrician with 4 months you should start complementary feeding, you are not going to exclusive breastfeeding to 6 months, mostly.
Yeah.
And then there is, of course, the education of the physicians, not only of the mothers, but also of the healthcare workers. So there are many elements who need, we say, it needs a village to raise a child, it needs a village to breastfeed a child. It's not only on the mother itself, herself.
Yes.
the last question.
Just that makes
Elien, what message would you like to share with mothers who are currently struggling with breastfeeding?
Oh, that's a difficult one.
Yes. Message.
First of all, especially when they are struggling, you are doing great.
Okay. You are doing.
And you're doing the best you can. And secondly, I really try to encourage them that even if they're struggling, that they have come to this point,
Yes.
you can congratulate yourself.
Yes.
Third, and that is one element I forgot to mention before. Breastfeeding is not about nutrition, it's not about health only, it's also about connection. And it's about giving your child who depends on you, your warmth, your love, and any milliliter of human milk is valuable.
Yes.
And try to find help, try to find support, and even if it doesn't succeed as you thought it would, you have done a wonderful job and you have given your child what you could. So you have given her skin-to-skin contact, you have given her your breast, you have given your milk, and you have given the best of yourself to your child. So that is what I would say.
Okay, thank you. Really excited to have this conversation with you, and we truly appreciate your time and expertise with us.
I think that was clear from this whole conversation. It's all about getting help.
Yeah.
And sometimes it's easy to breastfeed, sometimes it's not. And indeed, it's such a gift to have a clinic like this and to find the expertise here. Here are the people who know to help you, who have the knowledge to help you in the best possible way. So I really encourage you to look here for help, for support in your journey at the start of the life of your child.
Thank you for coming. Don't forget to follow us and for more tips and health info. And if you need any support, Sobat Puri Cinere is always here with you. Can